Stress affects people in many different ways, and sometimes people have a difficult time handling the challenges of events in their lives. Adjustment disorders can cause both psychological and physical symptoms. They may also affect a person's behavior. So let's talk about what adjustment disorders are. They're also known as situational depression or stress response syndrome. Refers to a short-term mental condition caused by stressful events in a person's life. The DSM-5 talks about more in depth about how adjustment disorder is a severe reaction to stress. The disorder affects a person's life on many different levels and may interfere with a person's ability to complete day-to-day activities. Both children and adults can develop adjustment disorders. A single stressful event or multiple situations may trigger this disorder. It can be caused by factors such as ended relationships, job loss, job change, death of a loved one, an illness, accident, crime, major life change, changing schools, moving, marriage, divorce, having a child, or retirement. We experience, as a world, we experience a traumatic event, COVID-19 in 2021, and the subsequent events of it. And I know for one, I experienced adjustment disorder, and my children did as well. Adjustment disorder sometimes is compared with post-traumatic stress disorder. There are similarities to the two disorders. However, adjustment disorder is a short-term illness. Post-traumatic stress disorder is something that lasts longer than 6 months. Symptoms of adjustment disorders can range from mild to severe. They can be psychological and they can be physical. They may include feelings of depression, sadness, hopelessness, agitation, anxiety, nervous, low self-esteem and worry, bouts of crying, lack of appetite, concentration issues, and suicidal symptoms. An adjustment disorder may also affect a person's behavior. They might participate in more risky behavior. They might commit crimes. They may drive recklessly. Events or situations that are not considered normal for them is something they might start participating in as a result of result of the adjustment disorder. The next thing I want to talk about the different types of adjustment disorders. The first one would be adjustment disorder with depressed mood. People that experiencing adjustment disorder with depressed mood will have depressive type symptoms. They'll cry often, do not enjoy the interest in activities that they once brought them happiness. Then there's the second one, adjustment disorder with anxiety. Now this one here is marked by feelings of being anxious and overwhelmed. Individuals this type of usually have trouble concentrating and experiencing memory problems. And then the third one is like a mixture of both of them. A person will have depressive mood and they have anxiety. And so when an individual begin exhibiting levels that are out of the norm for them, they usually are diagnosed with adjustment disorder with disturbance of conduct. So that's another one where they're just doing something different. They may start hanging around people that they usually don't hang around, or situations that they usually don't hang around. Maybe if they wasn't a type of person that would go to like a nightclub, all of a sudden they're going to a nightclub and they're drinking. They're maybe having multiple sexual partners. They're doing riskier behavior that's out of the norm for them. An overview of the adjustment disorders. It could be some people with adjustment disorders may not even be aware that the stress is causing them to feel this way. They may not even be aware that that traumatic event has had that type of a strong effect on their lives. Symptoms usually appear during or immediately after the stressful event, although they can show up within 3 months after the situation occurs. The disorder generally lasts about 6 months, but it can last longer if the stressor causing the disorder is not addressed or is not treated. When physicians diagnose patients with adjustment disorder by they can diagnose a patient with adjustment disorder by analyzing patient symptoms to see if they meet certain criteria. So one of the most important things is looking at specifiers and modifiers. The specifiers and modifiers are going to be an important key, because if a person if it's just adjustment disorder and not PTSD, then of course that treatment is not going to be as intensive and not going to be as long standing. Also, if it's generalized anxiety disorder, or if it's something that the person is just going through every single day, and it's a constant response every single day, then doctors need to be able to specify that it's not just from this event, like a weather-related disaster or earthquake, or a act of violence, or a sickness, or change in one of those change in relationships type situations. Doctors need to know specifically how am I going to treat this in the duration of the treatment. So specifiers and modifiers are going to be key in the treatment of adjustment disorders. Thank you.